If you've been dealing with knee pain and OA, this video will walk you through treatment options from medications to physical therapy. Hi, it's Daniel from Supply PT, where we help people get back in motion. If you are new here, please go ahead and click that subscribe button and all the links to everything we mentioned in the video, which you can find linked in the description box below. Now let's jump right into it. Knee osteoarthritis is one of the most common degenerative joint diseases, affecting millions worldwide. Much like how a car's suspension system gradually wears down with repeated use, the cartilage in our knees, the body's natural shock absorbers, can also wear out over time, leading to pain, stiffness, and limited mobility. While there's no cure, a variety of treatment options can help manage symptoms, allowing people to continue their daily lives with improved comfort and mobility. This video delves into the different treatment avenues, from medications to physical therapy, to help those with knee osteoarthritis make informed choices for their unique situations. Medications for pain and inflammation management. One of the first approaches for managing knee osteoarthritis is medication aimed at controlling pain and inflammation. These treatments can be thought of as a tool to dull the noise of pain and make daily activities more manageable. Always check with your physician before starting or taking any medication. 1. Over-the-counter pain relievers. Medications such as acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, are often the frontline defense against osteoarthritis pain. Think of them as a temporary volume dial, turning down the intensity of pain so that activities like walking, standing, and bending become less of a strain. These medications work by reducing inflammation and blocking pain signals, providing relief that can be a game changer for managing day-to-day discomfort. 2. Prescription medications. For more severe cases, prescription medications may be necessary. COX-2 inhibitors, a class of prescription NSAIDs, offer effective pain relief with a reduced risk of gastrointestinal side effects, a common concern with traditional NSAIDs. These are particularly beneficial for individuals who need stronger relief but are sensitive to standard NSAID options. For those unable to take oral medications, topical NSAIDs offer an alternative, providing localized pain relief with fewer systemic side effects. Currently, celecoxib, Celebrex, is the only COX-2 inhibitor available in the United States. 3. Injections. For cases where pain persists despite oral or topical medications, injections can be a more targeted solution. Corticosteroid injections are often used to control inflammation directly within the knee, offering short-term relief. Meanwhile, hyaluronic acid injections aim to improve joint lubrication, similar to adding oil to a squeaky hinge. Though results can vary, some patients find relief and improved mobility, making these injections a helpful tool for symptom management in certain cases. Physical therapy and exercise. While medications help manage symptoms, physical therapy and exercise are foundational to knee osteoarthritis care, focusing on long-term joint support. Just as a well-maintained engine performs better, a well-conditioned knee joint is more resilient against pain and stiffness. Role of physical therapy. Physical therapy strengthens the muscles around the knee, particularly the quadriceps, which helps stabilize and support the joint. This targeted strengthening can ease the workload on the knee itself, much like reinforcing a building's foundation to prevent structural strain. Types of exercises. Physical therapists often recommend low-impact aerobic exercises like walking, cycling, or swimming, which are gentle on the knees while promoting cardiovascular health. These exercises, along with specific strengthening routines, help maintain flexibility and mobility without adding stress to the joints. For those with knee osteoarthritis, the goal is not high intensity, but consistency, creating a sustainable routine that supports joint health. Benefits of consistent exercise. Regular exercise can significantly reduce pain, delay disease progression, and maintain independence. Over time, a customized exercise program can enhance knee stability, making daily activities easier and safer. Assistive devices and lifestyle modifications. Beyond medications and exercise, various assistive devices and lifestyle changes can reduce joint strain and improve function. For example, knee braces, canes, and shoe inserts are like added support beams, helping to shift pressure away from the knee. Weight management is equally crucial. Reducing even a small amount of weight can relieve significant stress on the knee joint, much like lightening a load on a worn suspension system. Alternative and complementary therapies. Some patients find additional relief through alternative therapies, although results can vary. Acupuncture, for example, has shown mixed evidence, but some people report benefits for pain management. Supplements like glucosamine and chondroitin sulfate are also popular, though their effectiveness remains debated. Additionally, mind-body techniques like meditation and mindfulness may help manage pain perception, offering a way to cope with chronic discomfort. Surgical options for advanced cases. For those whose knee osteoarthritis has reached a point where conservative treatments are no longer effective, surgical options like partial or total knee replacement become viable. This is often a last resort option, but for individuals with severe osteoarthritis, these procedures can dramatically improve quality of life, allowing them to return to activities they once thought were no longer possible. Living with knee osteoarthritis can feel like an uphill climb, but the variety of treatment options available today can offer relief tailored to each individual's needs. Whether through medications, physical therapy, lifestyle adjustments, or even surgery, managing knee osteoarthritis is about finding the right combination of strategies to maintain mobility and enhance quality of life. As with any health condition, consulting with a healthcare provider is essential to determine the best approach, ensuring that treatment decisions align with each person's unique circumstances and goals. Stay informed by subscribing to our channel, stay proactive in your care, and remember, at Supply PT, we're here to help you get back in motion.